30+% of our children are overweight or obese. That is astonishing.
Research has shown that 1/3 of cancer deaths are directly related to lifestyle choices, and specifically the issue of obesity. The same research also shows that the younger in age that someone encounters obesity issues, the more likely they are to develop certain types of cancers later on in life.
genHkids is a grassroots coalition with a straightforward mission to create a generation of healthy kids through education and empowerment, proper nourishment, and enhanced physical activity, thereby reducing the incidence of childhood obesity and its detrimental health effects.
By the time a patient walks through their physician's office door, what's occurring is no longer preventive care, it is disease screening. And so to do real preventive care in the field of medicine, we need to be reaching our patients, our children, in their day-to-day lives and encouraging them in the things that they need to do to stay healthy each and every day. The most important of those things include eating right, getting enough physical activity every single day, and getting adequate sleep every single night.
We spend as a society billions of dollars on techniques and strategies to educate our kids, and I think sometimes we overlook some of the most obvious and simple solutions that are out there, and one of those is making sure that kids are well nourished and active and feeling good about themselves.
genH was born out of what I saw as a real need in this community, to begin teaching our children from a very young age how to take care of themselves in the best way possible, how to make their own best choices so that they can develop lifelong habits that will help them to be healthier.
genH programs are created and implemented by highly educated, dedicated, and qualified professionals who volunteer their time and talents to serve on action teams focused on physical activity, nutrition, education, and policy. One of the best ways to ensure the health of our families is to prepare from-scratch meals at home. genH chefs educate families on how to get from the grocery store to the dinner table through the Destination Dinner Table program. Jay Kitterman, director of the Culinary Institute at Lincoln Land Community College, talks about these events.
Our goal by doing so was to show that it's easy, it can be done very quickly, it can be very nutritious. We try and use local foods whenever possible, and of course we want to make sure it tastes good.
Research shows that children who participate in the production of their food, whether in gardens or in the kitchen, are much more likely to try and to like those food options. Vegetable gardens, therefore, are an excellent opportunity to expand young palates and instill healthy eating habits. Dr. Latha Pandrangi, Nutrition Action Team Leader, explains.
We also hope that by implementing school gardens, the kids can actually develop a taste for the different vegetables that come out of their garden space. And since they have the ownership of the space, they're more likely to try, and actually trying is the first step towards healthy behaviors.
The 100-year Heart Health Fair teaches students invaluable lessons about health and wellness, while the Family Health Fair reinforces lessons learned through follow-up student activities and parent education. Children achieve optimal learning through interactive education followed by personal and parental reinforcement. Hope Danielson, Health and Wellness Advisor for Neiman Foods, shares her experience educating children at the health fairs.
I myself am able to go and talk to the kids about nutrition, especially about sugars and fats and what's in certain foods and what they might be eating. And it's a real eye-opener for kids. They're able to walk away with an understanding of, how much too much sugar can be and too much fat, and what better choices there would be to make if they're eating more fruits and vegetables, and what that can do for their body.
Children should receive no less than 60 minutes of moderate to vigorous physical activity daily. When children are physically active during the school day, they perform better academically, behaviorally, socially, and psychologically. Kimberly Flanagan, Physical Activity Action Team Leader, encourages kids to move in a variety of ways.
They do not have to participate in organized sports. They can do whatever they like to do, whether it's going outside and shooting hoops, or riding their scooters, or rollerblading, roller skating. Any movement is good. It can be anything that they truly love to do as long as they're moving.
genHkids interventions, programs, and events have been widely embraced by the community. Since its inception, genH programs have educated and motivated more than 10,000 Sangamon County children. Additionally, Dr. Sarath and Action Team leaders have provided continuing education to more than 2,000 educators and administrators, 500 health professionals, and innumerable parents and caregivers. City of Springfield Ward 2 Alderman Gail Simpson enforces the importance of an organization like genHkids in our community.
It's not always an issue that the city itself can do. So when you have a community-based organization that's doing, that just adds to the effort to make our youth healthy and they grow into healthy adults.
The unique approach of the genH Coalition has been that we create the programs and then we implement the programs. And so far that we have managed to do this almost entirely with the network of volunteers that we have and with this coalition of anchor partners that we have knitted together in this community. That's really remarkable that in the last year we reached 10,000 children and 2,000 educators and another 1,000 parents and another 1,000 health professionals just with our volunteers. That's really an amazing testament to the power of this organization that we've created.
genHkids owes much of its immediate success not only to its committed leaders and dedicated volunteers, but to its impressive list of anchor partners. genHkids Coalition anchor partners are organizations recognized by the community as having leadership roles in health, wellness, and education. Kim Laws, Manager of Education and Outreach at St. John's Hospital, emphasizes how the genHkids collaborative approach to children's health works.
And genH has really provided a means to bridge that gap, to get into the schools, to allow us more time with the children, with the parents, with the teachers, bring all those pieces together so we can fully educate all and provide a whole piece of the missing puzzle of health in our community.
Although our schools are an obvious and vital resource for beginning to improve the health of all children and combat the obesity epidemic, it is clear that our schools are already seriously overburdened and underfunded. It is incumbent upon the genHkids Coalition and its anchor partners to not only create, but to also implement health programs for the schools to positively impact their educational bottom line. Springfield, Illinois public school administrators discuss the impact genHkids has made at the schools.
It's a strong coalition in the Springfield area that is focusing very, very hard on the crisis that we have regarding childhood obesity. And you have a small number of committed individuals that are attracting additional resources to fight this epidemic and to do whatever they can to improve the wellness of our children here in Springfield.
It was very relevant to me in terms of looking at the impact that healthy eating and exercise, the impact that has on student achievement. So we wanted to really take an in-depth look to see if we can build on this correlation and how we can infuse some of those initiatives that can help our students around student achievement.
Without question, education is preventative medicine in its purest form, educating and empowering patients, children in particular, to make their own best lifelong choices regarding nutrition and activity is the surest way to improve overall child health, prevent obesity, and avoid innumerable health consequences. Bob Ritz, President and CEO of St. John's Hospital, highlights why childhood obesity is a major public health priority.
genH Coalition has made a big mark in our community with respect to dealing with obesity, specifically childhood obesity. And because of the leadership and the vision, the passion that genH has brought to our community, St. John's, through our board of directors and our community task force, has adopted addressing childhood obesity as the #1 priority.
Budget considerations and time constraints are no longer legitimate excuses for delaying action. It is time for all of us, parents, educators, health professionals, legislators, business owners, and citizens to act decisively. We must immediately take all action necessary to curtail the childhood obesity epidemic and to ensure the health, safety, and success of the next generation. Public health professionals stress the connection between children's health and the future of our workforce.
Organizations such as genH are going to be a primary part of the solution to the national and really international problem of childhood obesity. Because again, while we have lots of science that says do this and not do that, We don't know necessarily how that science is best applied in various communities, how that science ought to be communicated, what the societal norms are in that community. And so again, genH is a very critical link between the people who find out facts, as in what's good for you and what's bad for you, and the people who are faced with this deluge of information and having to figure out which facts are good, which facts are bad, what really works.
The business community is recognizing now that healthy families translate into a healthier bottom line for them. That when their employees' children are healthy and fit and physically active, that not only are their employees more productive, but that insurance costs go down. We also see businesses start to understand that the fitness of this generation of children is going to translate into the fitness of their business in the next 15 to 20 years.
The public health crisis that the obesity epidemic represents is unprecedented and will be catastrophic. genHkids executives and community supporters convey why it is essential to invest in children's health.
By investing in the coalition, you are truly investing in the health of our community.
100% of dollars earned go into supporting our programs.
Even though these children are so small now, they're our investment in the future. And so we need to invest in them if we want to have a healthy workforce.
When I think about how I use my time and my resources, not just as a professional, but as a father, as a citizen, as an Illinoisan, as an American, I think that it is my duty to support organizations such as genH for a number of reasons that the most important reason is that evidence is increasing that the health of the current generation of kids is going to play a key role, not just in terms of how healthy a country we are, but also in terms of how wealthy a country we are, of how secure a country we are. So really, every individual ought to find a way to do what they can to address this problem.
When children grow up with a good sense of who they are, what they're capable of, and with bodies that are healthy and active, there's no limit to what they can accomplish. Unfortunately, organizations like the Generation Healthy Coalition need tremendous support in order to do the things that we do. Ultimately, the programs that we bring to our children are so important because they empower the kids going forward to accomplish everything that we would hope that they can. It's important for us to teach them. It is also important for us to protect them. And that's part of what genH's mission and goal is to do, and that's to protect our children. Because we have to remember these are our children. It's our responsibility to make sure that they are being well nourished. They're small. They're not responsible for their kitchen. They're not responsible for their school lunches. They can't go to the grocery store and buy the right types of foods. We have to do that for them. And so as a community and as a country, it is time for us to step up. It's time for us to step up and begin nourishing our children rather than malnourishing our children. It's time for us to step up and make sure they're getting the gym space that they need, the playgrounds that they need, and the time that they need to be outside and be active children. It's our responsibility as the grown-up to make sure that our children have everything that they need to grow up healthy and happy. We're so proud with everything that we've done at the genH Coalition, and we really, really do appeal to you to help us continue our mission of making sure that our children are healthy, happy, active, and productive in the future. Thank you.
Please join us in our efforts to improve the health of every child in our community. If you care about our children, their health, and their future, visit us on the web at www.genHkids.org to learn more about how you can volunteer or donate to the genHkids Coalition.